Hi friends, hope you're doing well. I'm Dr. Milind. So INICET exam is very close and there are a lot of questions that are going through aspirants' mind. So here I am with the final checklist for INICET November 2022. I'm not going to take a lot of time, but there are some things which are INI examiner's favorite, and I just want to point out those things in a short span of time, which will definitely help you. And also, if you there are some questions in the minds of aspirant about how to attempt the paper, so I'll try to answer that as well. So when we talk about INICET exam, so what should be our first target? So as I have said again and again in my previous videos about the previously asked questions, year questions. So you should do last 3 to 5 years question. If you don't think that you have enough time, at least last 3 years you must do. And if you think that you can spare some time, so you can go as far as the last 5 years, and aims and GPAT also you can include in that. Also, this lot of students ask me out, sir, what about explanation? See, as I said that sometimes the questions they do not repeat themselves, but INI has a habit of introducing certain topic in a previous exam and they'll ask some advanced question in the next exam. So always at least have a quick glance through the explanation, so that will definitely be back of on the back of your mind, which will help you in exam. As I said, topics to repeat. If you I have always recommended first USMLE first aid book for especially for INI exam. So if you have already read that, you can just quickly go through the charts and images. If you have not opened the USMLE first aid, it is not must. Do not open it now. There is no time. Whatever you have been reading, you have to continue with the same. Now I just want to quickly go through the favorite topics of INI, and there are not. It's not a big list, but very. I mean, there are some things that are you will always find in INI exam paper. First, I'll talk about the basic sciences first. Then about sagittal and coronal views of brain. So there are a lot of different sections and the slices of the brain in anatomy. They specifically ask. So they will point out some structure from the basal ganglia or maybe from the brainstem, and they will ask you to identify the structure. It's very common, very favorite question of examiner. Second is cross section of the heart and the mediastinal structure. So they will put a pointer on maybe on a pulmonary artery, maybe on a aorta or any mediastinal structure, and it's also a very favorite question of examiner. So be thorough with this few things, and also embryology has always been a examiner's favorite for INI. So you should know the embryology of the heart, how heart develops, how the great arteries develop, the portal vein. Just few things about the intestine, how it evolves, the rotation, aortic arches, how they develop, bronchial arches, and fetal circulation is also very important. If we talk about physiology, see physiology again and again, not many questions are being asked in INI, but there are some questions which have always been asked. First, I'll say about nerve and muscle structure and physiology. So that is also you should be knowing. Cardiac cycle, fluids and electrolyte are again examiner's favorite. Structure and function of nephron, how the urine is formed, which the like about the filtration and about absorption of different minerals, and that you should know well. Also ECG, some basics ECG are asked, and they're again examiner's favorite, and this is where you can actually score a good number. You don't have to go in detail about ECG in depth, but few common ECGs that you should know, like blocks and like PSP, you should be able to identify those in your exam. About biochemistry, again, last time there were a lot of questions from biochemistry, so you should be knowing. I'm telling you this for the last few days. So as all the enzymes, all the cycles are again important, they'll ask you, they will show you the cycle. One enzyme will be missing, and they'll ask you to identify it. These are again scoring points. See, this is all you know. This is not something that you need to like study or know a lot of things. So this is something that is, I feel, uh, this is where you can actually score about glycogen storage disorders, mucopolysaccharidosis, and then enzyme defects, and the brief clinical pointers. See, it's not like the question will always be difficult. There will be something that will give, but it's like cherry red spot or a particular finding that is very specific for that particular metabolic disorder. So you at least be thorough with that. And if you haven't revised those enzymes, then this is the time when you should revise. For biochemistry specifically, first aid charts are very important. Then again, classification of amino acids, DNA, RNA, protein synthesis, how it is done, and a few important enzymes in the pathway. Again, examiner's favorite. And application of different tests. So you'll see a lot of test tubes, urine of different colors, or some enzymes like reactions that happen. So they will show you the test tube pictures. They'll ask you to identify the diagnosis based on those findings. So these are something that are very important, in particular with INI. About pharmacology, again, basic pharmacology, about the pharmacodynamics, pharmacokinetics, again, examiner's favorite. antidote. There were a lot of questions on the antidote, and again, USMLE first aid to the rescue. A lot of questions were from the charts last year, INI as well. Also, recently approved drugs. See, there are lots and lots of drugs that are approved every year. You don't have to go through everything, but any information that you have gotten in the class, be just familiar with it. Now, if we talk about next about patho, again general patho, again always examiner's favorite. Genetics inheritance pattern, which is autosomal dominant, autosomal recessive. They will give you the pedigree, and they'll ask you to identify which pattern of transmission it is. And it's always confusing. Like a lot of students, they do a silly mistakes in these are easy questions, and this is where actually you're going to score marks. The images of first aid are again important for pathology. If you have the PDF or textbook of Robbins, you can just go through the images of Robbins as well, because exactly those images I have seen into in they have asked the similar same image in INA exams. About microbiology, in a lot of students they ignore fungal. They focus a lot on bacteriology and virology, but they neglect fungal and parasite. But that is again very important for INI. The cycles, the images to identify the cyst. Again, examiner's favorite. COVID, they have always, the all exams have given pass for COVID till now, but I feel still you should be, have knowledge about COVID and especially about the COVID vaccines. Again, agars and causative agents, there are always pointers, they will ask you to identify the bacteria. Sexually transmitted disease, again, I have talked it in dermatology as well. It is also it's also examiner's favorite topic. Now, lastly, I'll talk about just miscellaneous topics, which you can use it as a checklist. It's about the toxicology and declarations of forensic medicine. Again, sexually transmitted diseases, how to diagnose, like what are the differentiating factors in from dermatology, you can know it. PSM, basic biostatistics. Lot of students do mistake that they feel that biostatistics is either boring or tough. But there are very simple things like how to calculate sensitivity, specificity, positive predictive value, negative predictive value, odds ratio. They're very easy things. They will ask you to identify which type of chart it is. So it's like you should just know the name. They are not going to ask you very difficult questions in the biostatistics. And this is something a lot of students give it a pass. So the toppers they have they take advantage here. Also, new programs, whatever the government has used, introduced in the recent times, updated data, targets, goal, like what is maternal mortality rate, what are the targets, and such kind of goals and target that you should know, and that will be asked in your exam. Surgery, there are a lot of things in surgery, but what are INI's favorite is about trauma, how to do the triaging, and some basic instruments. They'll ask about cannula, they'll ask about Foley's, they'll ask about NG tubes, basic things, and also burns. So at least just make sure that you haven't skipped this. In obs gynae, there were a lot of questions in the last exam. Know about the infertility contraceptions, and again, infections are again and again asked from the obs gynae. About pediatrics, few things about vaccine, developmental milestones, and congenital heart disease. Also, they'll give you a scenario and or maybe ECG or a 2D co findings, and they'll ask you to identify the defect. These are basically topics which are INI examiner's favorite, and I think you can. And if you ask me, like, I'm not telling you to go somewhere. Like, if you haven't opened a first aid, don't do it now, but you just have to go through your same notes which you have been reading, and you have to just give extra attention to these topics which I have said. Now, when we face the exam, a lot of students ask me that how many questions to attempt and how should be our approach to a question paper. So first of all, read a marking scheme carefully. A lot of students, they just start writing a paper. A lot of students, they ask me after exam, sir, what is how the marks will be counted. So it will be always there. It is there in the brochure, but it will also be displayed when you start your exam. So that will take away your anxiety. Now, if you are someone who is eyeing a rank between 1 to 200, you have to attempt more than 190 questions. You cannot attempt less than that because everybody is going to take a risk. I have interviewed a lot of toppers and I have talked to a lot of toppers. I myself have attempted 196 question when I gave my exam, and I have seen all the toppers who score rank within 200. They go for 190 plus because the marking scheme is in your favor. You get more marks for attempting a correct question. So that is why you should always attempt more. Second is if you are someone who want to plan, play safe, who feels that 200 to 1000 rank would be good enough for me. I don't want to take extra risk and spoil my rank. Still, for you, I'll tell 180 to 190 is a good attempt. Like if you do that, then you are not taking any risk. So that additional benefit you will not get, but you'll still end up between somewhere between 200 to 1000. But what I want to tell everyone that do not attempt less than 170 in any case you want if you want to stay in competition. Don't be hero. Don't try to be hero. Like if you attempt less than that, you'll be out of the competition. I mean, it's just in a very rare case when someone is very sure and exceptionally talented and who is sure about all the questions, then that is a different case. But do not attempt less than 170 in any case. What you should know that you don't have to give your 100% in all the questions. There will be 150 questions which are doable for everyone. Even if you are a topper or even if you are an average student, 150 questions will be of a similar difficulty for everyone. Of the last 50 questions, the 20 questions will be like, nobody ever heard. Even the rank one, they have never heard in their life. And everybody try their lucks in that. 30 questions will be, they will challenge your brain. They will take a lot of time, but there will be few students who have studied throughout their MBBS, and because there will be more of a practical questions or some from the standard books or maybe some from the latest research. So these will be brain tackling questions, and but they will still not decide your rank. What will decide your rank is the 150 questions that is doable for everyone. So it depends how many silly mistakes you do in those 150 questions. So remember, don't beat your head for those 50 questions which are difficult, but be attentive for all the 150 questions so you won't be tired at the when you're attempting your paper. Don't waste too much time on the questions which you absolutely have no idea. See, there will be some new drug and you'll try to remember it. If you have not read it, if nobody has read it, then how will you remember it? So don't spend too much. If you open a question, if you see something, you know that you might be you will never be able to answer that question, so leave that. You have remaining questions there where you need to give your everything. So don't waste too much time on such questions. There are three things, and you might feel that what I'm saying, but there are three things that you should be very, very careful when attempting INI exam. First is avoiding overthinking. Don't feel that it's a INI paper or it's a AIMS kind of paper. So they are introducing some twist, and I should overthink, and I should maybe examiner wants to ask in a twisted way because it's a INI paper. Don't do overthinking. Think that what you will do in a normal scenario. See, what are the most common things that should come to your mind first. Don't be in a hurry. No matter how easy question looks, don't skip the options. If you like, for example, if you read a question and if you see an answer in the second option, don't skip third and fourth option. Read all options well. Don't be in a hurry. Don't be an casual. Don't keep a casual approach when you attempt an paper. When you start your exam, if you are midway through your exam and if you feel the paper is tough, remember, it's for everyone. It's not tough for only you, and everyone reads the same material. Everybody has everyone doing the same classes. All teachers are the same. So whatever material that you have read, everyone has read the same thing. So don't worry. If the paper is tough, it's for everyone. And I have always said, INICET, what makes INICET special, that it's 50% of the preparation and the 50% how you attempt paper. So if you feel that you have not prepared well, there are two things. First, if you feel you have not prepared well, still you can get a very good great rank, because 50% is how you apply whatever you know in a proper way in exam. So still you can get a great rank. Second, if you have prepared well, the exam can spoil your preparation. So don't be casual. Don't do the overthinking. The attempting a paper itself is also extremely important. Lastly, I just want to tell you all, see, as I have said in my earlier videos as well, that brains are designed to keep us alive and not happy. So don't expect that, in next 10 days that your brain will die to keep you happy. It's okay if you feel anxious, it's okay if you feel sad. You will, if the thing is, this anxiety of exam is such that you will go through a lot of emotions in the last few days. But it's okay. Everybody is going through that. So you have to keep your calm. The hardest walk is walking alone, but it's also the walk that walk that makes you the strongest. A lot of students and myself, we have prepared alone. We have, this journey was not easy for anyone. But definitely, when you will come out of this, when you will get your result, you will realize that you have become a stronger person. Have become a completely different person. Have faith. You have worked. I have been, a lot of students write me, and what I have seen is people put lot of efforts. So you have worked for this. Don't worry, and you have got this, and you will definitely shine. So guys, I hope this video helps you. I wish you all the best and take care.